Over here, you can see the internal anatomy of the heart. The left atrium is very similar to the internal anatomy of the right atrium, with the exception of the fossa ovalis, which can't be seen in the wall of the left atria. Over here, you can see the right and left ventricles really clearly. You can also see the tendinous cords. You can also see the tricuspid and the bicuspid valve, as well as the semilunar pulmonary and semilunar aortic, where it's going to be located right in the back. The valves ensure a one-way flow of blood. And two types of valves are present inside the heart. We have the atrioventricular and the semilunar valves. These are all both made of endothelium-lined fibrous connective tissue, and they create these cusps, also known as flaps. The atrioventricular valves prevent the backflow of the blood through the atrias. The tricuspid valve is one of the atrioventricular valves that's located between the right atria and the right ventricles, and it has three cusps anchored to the papillary muscles and the chordae tendineae complexes that prevent the backflow of the blood from the right ventricle. The semilunar valves also prevent the backflow of blood into the ventricles, and these ones open up as the ventricles contract and the blood is forced into the arteries, and they close when the ventricles are relaxed. Keep in mind that the arterial pressure becomes greater than the ventricular pressure, and as blood starts to slide back, it catches up and cusp begins to close the valves. The two of these are the pulmonary semilunar, that's located between the right ventricle and the pulmonary trunk, and then the aortic semilunar, which is located on the left ventricle and the aorta. The pulmonary valve is one of the semilunar valves. It has three half-moon pocket-shaped cusps. So let's take a look at a clinical application. Teenage athletes and sudden cardiac death. Sudden cardiac death in high school athletes have occurred during athletic events and even during athletic practices. And a study done by the Journal of American Medical Association found that these deaths are occurred as a result of undiagnosed cardiac problems in these young athletes. The cardiac defects produce no signs or symptoms, and thus they go undiagnosed. However, when the heart begins to exert its maximal or near its maximal tension, these cardiac defects cause problems and can result in death. The cardiac defects ultimately result in what we call cardiomegaly, which is the enlargement of a heart, and thus resulting in death. Cardiomegaly can be caused by either cardiac muscle going through hypertrophy or enlargement and dilation of the chambers, or a combination of both. One of the best ways to take a look at diagnosis is through the chest x-rays as well as an EKG to diagnose the conditions. Another clinical application that we have is heart sounds and heart murmurs. You probably had an opportunity to go through a physical and be auscultated with the normal heart sounds, which are caused by the closing of the valves. It produces what they call the lub-dup sound. The lub-dup sound is due to, first, the atrioventricular valves closing, hence the lub, and then the semilunar valves closing, hence the dup sound. There are certain areas of the chest where the stethoscope can be placed to best hear the valve's closure. The tricuspid is best heard roughly at the end of the sternum, right between the fourth and fifth intercostal spaces on the right side of the border. And the bicuspid or the mitral valve is best heard at the apex of the heart, which is going to be at the fourth intercostal space down at the mid-clavicular line. The pulmonary valve is best heard roughly at the second intercostal space on the left of the sternal border, and the aortic valve is best heard on the second right intercostal space on the right sternal border. Abnormal sounds that can occur are referred to as murmurs, and murmurs are generally caused by abnormal activities in the heart, but sometimes they're not always associated with pathology. Let's talk a little bit about some of the kinds. We have two types. We have the valvular insufficiency, and we also have valvular stenosis. Valvular insufficiency is termed as valvular incompetence, also when one or more of the cardiac valves begin to leak. Valvular stenosis is scarring of the valvular cusps. So over here, going over what they are, valvular insufficiency is when the cardiac valves are leaking and the cusps do not close tightly, and therefore it might cause the heart to get large over time. The valvular stenosis is when the valve's cusps are scarred and they cannot open completely. And as a result, they reduce the chamber output of blood, and as a result, the chamber may also enlarge and dilate. So let's take a look at the fibroskeleton of the heart. The fibroskeleton of the heart, also known as cardiac skeleton, is composed of dense, irregular connective tissue. The cardiac muscle cells are arranged in a spiral bundle around the heart chambers, and they're reinforced and attached to this fibroskeleton. The fibroskeleton provides structural support at the boundary between the atria and ventricles. They also form a supportive ring that anchors the heart valves. Additionally, this fibroskeleton provides this rigid framework that attaches the cardiac muscle. This also provides electrical insulation between the atria and ventricles, thus not allowing the signal or the action potential to improperly travel. It allows it to travel in a more controlled fashion. All four chambers of the heart should never contract at the same time. Over here is a picture showing you that, a cross-section. You can see the fibroskeleton highlighted in white. You can see how the valves are attached to that, and then you can see the muscle almost wrapping around the outer skeleton. Over here is a cool picture showing you the ringing spiral structure of the heart's muscle. As you can see, it coils around the chambers of the atria and it coils around the chambers of the ventricles. Let's take a look at the microscopic structure of the cardiac. The myocardium is composed of cardiac muscle cells, and like the skeletal muscle, is striated and surrounded by an endomysium. Compared to the skeletal muscle cells, the cardiac cells are a little bit shorter, they're more branched, and they typically will have one or two central nuclei. The cardiac muscle is similar to skeletal muscles in very many ways. The T-tubules are also present, but the T-tubules are only there per one sarcomere, whereas for skeletal muscle, you might have two or more per sarcomere. The cardiac muscle also has the famous SR, the sarcoplasmic reticulum, that is less extensive than skeletal muscle, and it has no terminal cisternae or tight association with the T-tubules. Thus, this difference is due to the fact that calcium for the cardiac muscle comes from the outside of the cell, whereas calcium for skeletal muscle is located on the inside of the cell. You'll also see over here that the myofilaments are arranged in sarcomeres. This is an organization that gives rise to that striated appearance under the microscope. And at optimal length, there's going to be an overlapping of the filaments, which we'll talk about later, the protein and actin and myosin, where there's the maximal force able to squeeze the blood out of the chambers. So let's take a look at the intracellular structures. Cardiac muscle cells are strongly anchored together. That allows the rapid flow of the action potential from one cell to another cell. And the cardiac muscle cells must act in a confluent manner so that there is one muscle cell rather than a bunch of them. This confluent functioning of the cardiac muscle is termed the functional synctium. This is one big unit. And you'll see that the sarcolemma is also folded with different connections of cells. This allows the structural stability of the myocardium. It facilitates communication. And the cells are weaved together by the intergalactic discs that contain desmosomes, which are mechanical junctions between cells. And of course, the gap junctions, which allow for electrical joining of the cells so that the ions can flow through all unanimous. Intergalactic discs fuse the muscle cells together. And when you zoom into the intergalactic discs, you then have the desmosomes and the gap junctions. Another picture on the right-hand side, you can see the sarcomere of the muscle, the Z, the H, the M, the A band, the I band. The cardiac muscle has an extensive blood supply, numerous mitochondria, and other chemical components such as myoglobin and creatine kinase. The myoglobin and the creatine kinase are the ability to generate quick energy as well as bind oxygen without any problem. And the cardiac muscle has approximately about 25% of its volume dedicated just to mitochondria. And it makes sense because it's constantly contracting, whereas you compare about 2% in the skeletal muscle. The fact that it is able to use different kinds of fuel molecules is also really important. It can use fatty acids, glucose, lactic acid, amino acid, and ketone bodies. However, it relies mostly on aerobic metabolism, which means that it is susceptible to failure when there is ischemic damage or whenever the oxygen level is low.